So this is an interesting question, and there's several different, so I really find that for those that didn't hear, it is a question about how an illness like pneumonia can make dementia so much worse. And so the first aspect of that is any illness makes all of us worse. So if you've ever seen somebody who has the flu, I've seen one of my children with the flu just talking and babbling nonsense with a fever of 104, and I'm like, hey, you're not thinking so good right now. So we do know that in an acute illness, it is going to disrupt memory and thinking. And that can be an acute illness, could be a urinary tract infection, could be congestive heart failure, could be pneumonia, could be almost anything. Typically, people will rebound as they get better, they rebound. You all know as we age, we don't rebound quite as quick as we did when we were younger. For somebody who has injury to the brain already, dementia, that rebounding can actually be weeks. And so I usually say, I get called all the time by the docs in the hospital saying, we have somebody here who showed up with pneumonia and they are demented as all get out and they need to come in and see you now, Dr. Jicha. And I always say, we'll set up an appointment in 6 to 8 weeks. And the reason for that is it can take that long for someone to recover. So if it's the acute setting of a pneumonia and you're within that several week period, then I would say we just need to give them some time. Sometimes, though, we do see medical problems cause a drop in function that the person never recovers from. And this is really interesting, and a lot of study has gone into this. It turns out that one of the things that drives Alzheimer's and some of the other degenerative diseases in the brain is inflammation. So there are many disruptors or imbalances in inflammation, even in somebody who's not sick medically, but just has Alzheimer's disease. There's dysregulation of inflammation in the brain. So we think that for many medical conditions, that inflammatory storm that's raging in the body may actually cause more permanent injury to the brain, and we can see that as well. And that's our best explanation currently. We can show in animal models and in cells in a petri dish that if we expose them to high levels of inflammation, they will be damaged over time. And so that's one of the reasons why recognizing infection, getting people on treatment as soon as possible, reducing that inflammation is incredibly important. So we've got a few components there. One's the acute illness, and all of us is going to cause some problems. The second is the recovery period. How long is that? And the third is the real world realization that sometimes we do see people make these stepwise changes where they don't bounce back all the way, unfortunately. But again, I always say I'm an eternal optimist, and I always say, let's give them 4 weeks, let's give them 8 weeks, let's see what we can do to rebound and to do our very best to keep infection away. So get the flu shot every year. And I don't know why my mother-in-law refuses to get the flu shot. Refuses. And what came of that this year? She didn't get the flu, but she missed one of my children's birthdays because one of my children had the flu. So that's something a grandmother never wants to miss, the birthday of a grandchild. I'm convinced. So.